Hi, everyone. My name is Adriana Krasniansky, and I lead the research team here at Rock Health. It's great to be here as part of the Rock Health Summit virtual series. And today we're going to be discussing how innovators can, but actually need to meet the moment as we're thinking about serving older adults here in the United States. So, what I'm going to do is pass it along to each of our panelists to say hello and also ask them a question at the same time. The question being, how does the aging experience look different today in the US than it did 10 years ago? We'll start with Cameron.
Adriana, thank you. And thank you for allowing all of us to be on the panel. So my name is Cameron Carter, CEO and co-founder of Rosarium Health. We're a platform focused on addressing the built environment through home modifications and really enabling individual seniors to age with grace, age with dignity. And when we think about what's different today compared to maybe 10 years ago when it comes to just the aging experience, beyond the overt diversity of this country, we also think about just the way people want to age, whether it's through multi-generational households, whether it's sort of living independently in 55 and other communities. So I think what's something we're seeing at Rosarium is just where seniors are living, how they're living. It's much different than it was even 5 years ago before the pandemic. So that's something we're mindful of because we meet seniors where they are. So we're always mindful of meeting them in apartments, single family homes, mobile homes, and things like that around the country.
Thanks, Cameron. Abby, next.
Hi, everyone. Abby Miller-Levy. I'm the managing partner of Primetime Partners. I run a venture fund focused on aging and longevity. So this conversation is my jam. I love talking about this topic. We've been at this for 4 years, and so certainly have learned a lot, having looked at 2,000 startups, seed to Series A, that focus on the health span and wealth span of our population. So happy to share what we've seen and make some asks of the community of things we need built.
And Abby, tell us, how are you thinking about the aging experience differently today than it was 10 years ago?
It is far more dynamic, complex, and costly than it was 10 years ago. But that's the great thing about technology. Technology can and should be able to help us with some smart founders behind it manage this complexity. So it's a perfect problem for entrepreneurs to be addressing.
Super smart. Rigo.
Well, hello, Adriana. Hello, all. It's a real pleasure to be here with all of you today and to talk about the aging experience. Rigo Saborio, I'm vice president of the SCAN Foundation, which we envision a society where every adult has the choices and opportunities to age well with purpose. And what I've seen over the last 10 years, and I think Cam sort of alluded to this, that certainly not only is the overall older adult population growing, but it's certainly the percent of diversity within that population is also increasing. And as a result, I think, and particularly when COVID happened just a few years ago, I think that there was a reckoning and really, a real awareness and understanding of the impact of the implications of having an increased diverse older adult population, particularly thinking about from a race and ethnicity standpoint, and many of the issues that brought with it, but also opportunities. So not just challenges, but assets from the community. So thinking about the gaps and in terms of disparities, the longevity, the sense of taking personal, the personal preferences and needs and priorities into account of the population. So with every challenge, as I said, there has also been opportunities, particularly for those in this field of innovation and creativity.
It's interesting. All three of you in your intros and kind of answering that question really talked about, the opportunity that sits today. And it sounds like a lot of that opportunity is not just thinking up new experiences, but it's maybe retooling or refurbishing the current care infrastructure that we have that serves seniors. One of those retools is going to be related to virtual experiences, right? We know that 70% of seniors in the United States, per Rock Health's Consumer Adoption Survey, have used virtual care at some point. So, I mean, that's a majority point. But there's still so much in the infrastructure, whether it comes to home care, whether it comes to senior living facilities, whether it comes to general provider, food infrastructure, all those kind of components. Talk to me a little bit, each of you, about how you're thinking the infrastructure in the US that supports the aging experience. Where are there really big gaps? What are the things we really need to be focusing on to make sure that we're that we're entering, kind of building positive aging experiences with the infrastructure we have? And is that possible?
Well, I'll start from kind of a systems point of view, which is first of all recognizing that we're talking about care, and so that these, it's a portion of older adults who need care. But the one word that I think everyone would agree on is fragmentation. Is that, and that exists in all areas of healthcare, but it's more acute for the polychronic that are going in and out of different care settings. And may or may not be making decisions wholly on their own. You also then bring in the family and the 50 million family caregivers. So now we've got multiple conditions, multiple settings, multiple individuals involved in care delivery and care decision making, and potentially, if they're dual eligibles, multiple payers between Medicaid and Medicare. So that level of complexity is something that is the opportunity to solve. And that really is just, if I just kind of put it up at the systems level, that those are the types of things we're working on. Now, what we're seeing at Primetime in terms of some of the solutions are a couple of things. One is care navigation and kind of a quarterback to help say, okay, there's all this fragmentation, and think about players on a football field. You still need your quarterback to make sure that everyone's doing their roles. So there's a whole bunch of businesses that are focused on the care navigation piece of things. And then a second area we're seeing is on data integration, because remember, in post-acute care, pretty much every area, each of those facilities has a different technology system. There's one for home care, OT, hospitals, you name it, everybody has their own system. So then we've got data integration opportunity. And then I think, so we see a lot of innovation around that. And then I think we see a lot of innovation happening really around care in the home, which is something that Cameron and his business are focused on. And I think and in the community, which Rigo is focused on. And so we're seeing also this shift out of hospitals for the most part, and hospitals are really becoming surgery centers, into care in other places. And so that's also an area of opportunity to be delivering the right type of care by the right level clinicians in the most appropriate and highest impact care settings. So, again, that's a broad strokes, but I think that'll probably give some food for the other panelists to munch on.
Yeah, and I can add to that. I think care navigation, data integration, and care at home are things that we think deeply about at Rosarium Health. And the way we build our model is that we leverage clinicians, particularly occupational therapists, to go in the home and do these home safety assessments to say, how does the built environment look? What are the needs of this individual? And that could not only be the grab bars and the wheelchair ramps, that could be things like pest control to enable home care that actually needs to happen. And other ways that we think about this on the data integration side is sharing back that information to PCPs, specialists, to the 50 million caregivers, such that everyone is on the same page to ensure that there's not any fragmentation, to Abby's point, in the care continuum, but also ensuring that continuity of care happens year over year as someone's care needs change, whether it's because they have a disease state or they're just aging on their own. I think additionally on the care at home side, one thing that we see a lot at Rosarium is that there used to be this shift from really around fall prevention and helping people sort of like stay at home to really thinking about reducing the risk of long-term care and institutionalized care. And this kind of gets something we'll talk about a little later, but just how how expensive some of these other care sites are compared to the home. And we think about this diverse population who may not have the same wealth accumulation as other populations previously, how important that is today, such that you're not having people who may spend through all of their net worth just to stay in a home for 4 or 5 years to come back to their original home. So for us, it's really being mindful of enabling individuals to be their best self in their best location, but ensuring that we don't encroach on care, we don't fragment care navigation, we don't allow data to slip through the cracks, but ensuring that folks can actually live in the community as long as they need to or want to, even if it's renovating a home or just helping someone understand where the resources are. So at Roseanne, we just really kind of serve as a complement, but it's tough because, when someone's living in a rural setting versus an urban setting, some of those resources may not be there. So as an entrepreneur, it's always important that we think about how do we support this person beyond our business, whether it's referring them to another one or being mindful of adding services to support this population as we evolve the business as well.
Yeah, and I'll take sort of my responses from the sort of the consumer standpoint, and I think about what Abby mentioned about fragmentation, and then Cam mentioned about the services that are available. I think what often happens is that many of the older adults who are needing care are one facing the daunting, situation of having to go to multiple locations for services that ideally, if you weren't through a, sort of a single door for all, services, would be much better coordinated and much better outcomes. Um, and and also being able to navigate through that is a challenge. That being said, what's currently happening is there's a significant number of older adults that, one, aren't even aware of the services that may be available that align with the needs that they may have. And that also extends not just to the older adult themselves, but the family caregiver also, who may be in that ecosystem of trying to help them. And I think there's also a need for basic education and information around: what does Medicare pay for? What does Medicaid pay for? What public benefits are out there to support, to help me also to enable me to access affordable quality care, both primary as well as long-term services and supports. So these are the challenges that are faced. So we at the Scan Foundation have looked at this, and our approach is really to take a human-centered design approach, and that is embed ourselves in community and begin to, have these conversations with community and identify, given these challenges, what do you see are the areas of most need for you that may be leading to your current situations, and what you perceive as life inequities, as and what are you doing to sort of overcome some of these? Because that then helps us to accurately understand what's happening, and at the same time helps to inform our, from policy system change solutions, taking into account what they're telling us, rather than, I think, for so many years before us, assuming what is needed. And I think that approach, particularly when we think about diverse older adult communities and populations, have resulted in where we are today, which are these inequities and disparities as a result. So we're trying to change that dynamic by going directly to communities and having those conversations, and together figuring out what are your priorities and what are the best solutions. And because it's oftentimes that those conversations are happening with the older adults themselves, particularly from the older adults with marginalized identities.
Yeah, I mean, it's so interesting. I think one thing I'm hearing across all of you is that, when we talk about the infrastructure of a successful aging experience, right? It's not even so much physical as it's a systems design question, right? Like, are the systems working together? Are the systems coordinated? But it's also this human empowerment question. Is someone empowered to know what questions to ask, or to know what they have access to? And are they empowered to kind of voice their preferences and their goals? And Cam, you said something really important of just, what does it mean to age with dignity and with grace, right? And how do you get to choose what that looks like, and then ask that of the system and the community that's kind of supporting you? I think the other pretty interesting thing that Abby, you were mentioning, right, is just the size of the community that supports each aging experience, right? It's not just the caregiver or the caregivers that are your family and loved ones, or sometimes professionals who are staffed to support that, but it's also your care navigator, the digital startups and solutions that are supporting you too. The one thing though that Rigo, you kind of mentioned, or we started to talk about, that's kind of the undercrux of here is, you know, how are we paying for this, right? And how are we really paying for the systems to work well, or the extra support that's needed to get those systems to coordinate? I think otherwise, so much of the cost of aging has really been put on the consumer, right? There's this burden of cost, there's this burden of responsibility. 1 in 10 aging adults is in Medicaid debt, in medical debt here in the United States, right? So maybe we'll start, Cam. I can imagine there are a lot of folks that you work with who have a lot of questions around paying for home modifications, but would love to hear a little bit more about how we should talk about the cost question when it comes to aging support.
Yeah, when I think about aging support, I think it starts with, I always think about a Social Security question. I think a lot of times folks may not even know how much someone gets in a Social Security check. It's only $1,800 a month. And we think about nursing home and institutionalized care, it's 3 or 4 times that on a monthly basis. And in addition to that, a lot of folks who are older adults never paid into Social Security just because of the jobs they have, the jobs they're even allowed to even have as a younger adult. So they're not having the again, the wealth or just the finance to pay for care. So they're having to be very scrappy, very nimble, having to rely on public sector funding, if you will. And I think that's where, going back to, Rigo's point about education, we see a lot with veterans and surviving spouses who may not even know they qualify for a home modification benefit, A, and then B, how do they access the funds? And then C, how much they actually qualify for. Because there's times where folks may think I only have a $2,000 benefit, ends up being $10,000 or $20,000 just because they went to the VA, got an assignment from a PCP, and understood how much capital is there. But we also see it in Medicaid and dual eligible individuals who may not know that there are home modification benefits in California, in Texas, and red and blue states that have always been there. However, they may not be called home modifications. They're called environmental accessibility accommodations. I'm not sure why it's called that, but that's what it is. So when people understand that's the actual what they're looking for, they do find it. And I think addition to that, on the care side, we won't talk so much about Part D drugs, but I think about all the adaptive equipment, the physical product that needs to be put into the home to really enable someone to be comfortable. And just, who are the right brands? How much do these things cost? What's covered under Medicare Part B? To Rigo's point earlier, sometimes those are things that we help with. And I think it's important for folks to understand that these things change. So just because of what you understood 2 years ago, may be much different this year. And that's something we also show up for when a home modification allowance was $4,000 last year. Now it's $12,000, and you should be able to utilize that, more importantly. So I think there's an opportunity to play, from all entrepreneurs as far as educating your consumers, educating their care team, and being a resource to enable these individuals to age with dignity, but also ensure that you're not speaking above your audience and assuming they know, because, I spend all my time in home modifications, but when I meet someone who's like, I don't want to do that, or what even is that, I have to take sort of a step back and understand where they're coming from. And that's opportunity that I think as well is super important in this older population of, hey, there's all these tools, all these resources, all this opportunity. Sometimes you just need a little hand holding to kind of go through that experience. And I think that's just an awesome opportunity to do at scale as well.
Yeah, it's really interesting to your point there. The one point about just how quickly some of these resources might change, right? Or some of the availability of accessing that resources at all might change, right? Abby, I'd love to hear a little bit. You're seeing several hundred companies over the course just of your career, thousands of companies. How are you thinking about business models in this space, right? Have you seen kind of evolution or thinking there? Would just love to hear a little bit.
I mean, the business models historically have been relying on payers. Medicare Advantage was the most eager and affluent of those payers to be looking to, and that has really evolved because there have been wonderful additional players from value-based care, ACOs, payviders, to now long-term care insurance players are starting to get involved in providing some healthcare services. So we're seeing actually a wonderful proliferation of types of payers. The piece I would add to the earlier conversation of who's paying for it is one of the shifts that I hope happens in the next 10 years is really the individuals making choices and decisions to the extent they can around their own health spans. Because the ultimate person who pays is the older adult who suffers from these conditions. Even if it's not fully financially, they're the ones with a suboptimal quality of life. And the sooner we can get people understanding in their 20s and 30s that the decisions they make, and by the way, there's genetics, there's social determinants of health, there's a lot of things out of people's control. But for the things that are in your control, how can we have a system that talks about health span and really helps people understand the trajectory of their health span, that their behavior and behavior change has a piece of it. So we get excited about the longevity health businesses that are working with people to understand gut health and autoimmune and all these other factors that contribute, hormones, like all these things that contribute ultimately to whether you get dementia, to whether or not that you've got gut health issues that are contributing to getting diabetes. What are the diagnostic businesses that we can intervene and understand our health earlier to make better choices so that we can prevent these downstream health effects? So I think we kind of work on this two sides of it, which is sick care and well care. And I think our payer system works on sick care, but our innovation system needs to work on well care as well as sick care.
It's a really, really interesting point. And I think one that we don't hear a lot of times when we talk about aging opportunities, right? But it is, like you said, a health span, right? So this is the way that you age is in many ways determined not just by that moment in time, but your past, your present, your future, your community, right? So super interesting there. And I think Rigo, one thing I also want to note is, we can't talk about supporting aging adults without talking about the work of foundations around, without talking about the work about, community organizations and others. Can you talk to me a little bit about how that work continues to be important, maybe how it's evolving and changing?
Absolutely. But I do want to go back before I answer your question, to Abby's point about, this is an opportunity to be innovative and creative and meet people where they are, and it's and it's helping in partnership with them through a life, sort of cycle. And it's not just when you get old, but truly when you're young. But what I would also add, though, is those who are, maybe thinking about that space and this opportunity, that just keep in mind, there's, no one size fits all, right? And there is, Abby, you pointed about genetics. Obviously, we have no control of that, but we also, in many cases, don't have a control of where we are born, and your zip code has a
Absolutely.
lot to do with, your life quality and life expectancy. And I think, like, my point there is, I think it's important to design based on those, what we may well have in common, but we also what's diverse. And I think back to you, the question of what's changed over the last 10 years. Again, I think that's the wonderful thing, that's that we have an increased awareness of that. And there's a concept that was coined by a professor out of Berkeley called John Powell, who said targeted universalism, and that when we think about, how do we impact all, we need to think about where segments of our populations and communities are, and we need to think about how we target solutions for specific populations, so that it enables us to really effectively and successfully impact everyone. And that being said, to your question, philanthropy, I think, has an incredible opportunity, given that, the as funders, we have incredible flexibility and opportunity to think about how we work in partnership with both government as well as the private sector, and complement the funding between them to really think about solutions. But again, as I continue to emphasize, that a partner in that also being community in that work. And I think that is also a unique position for philanthropy, in that we, through very careful and sort of methodical work, we have really built trust with community-based organizations. And at the SCAN Foundation, we're also taking that concept further and saying, we're not just trying to build relationships and trust with community-based leaders, but we're actually now also, asking those leaders to engage the older adults with lived experience themselves in that process. And so I think there's opportunities to really think about how we can, continue to nurture those relationships, fund those relationships. But because we bring that unique perspective, that, and also that trust with the players and that ecosystem, I think it enables us to really serve a convening role, that we're bringing community together with the innovators and the creators in this field, along with government. And I think that's what's also unique, is that we often work in silos, and a part of the work of the SCAN Foundation, also in carrying out some of this work, is really thinking about this from a cross-sector collaboration approach, so that we're not just talking, with and working with government, or are we just working with the private sector or just community. We're really thinking about this holistically, because only together can we really have a significant impact in aging for all, if we're truly going to have that, as an outcome. So that's how we're, I think we're uniquely positioned. I think we're also, able to bring other funders into, and collaborative and fund together. So it's not just one entity. I know in some of the current work that we're funding now, through in California in particular, we have funded 4 communities called the Equity Community Organizing Groups. We are funding that to, and shift power to community. to really think about bringing solutions in partnership with two other foundations, California Healthcare Foundation and MetaFund. So that's an example of how then we could also play a significant role and help to fund some of this work.
I think there's something really powerful that you said, Rigo, about, how do you support a community to support its aging population, right? And it's really equipping that community as much as it is equipping an individual to make the best decisions that they can, given their context and their experience, right? Um, I think we're just about at time, but I wanted to see if there was anyone who had a last thought or point about, something we're not talking about in aging that we should be, or just kind of a takeaway that might tend to get overlooked.
I'll just say this, and I have great admiration and appreciation for what the work that Cameron's doing and Abby's doing, and I think it really sort of builds on what I just said. I think collaboration is where you see these opportunities. I think aging is multifaceted, and it impacts one individual. It's not the same for all, and it takes that kind of work together. So I'm inspired by and motivated by what I heard of my colleagues and kind of thinking about their perspectives and what they think the solutions are. And my call to action, sort of my last words, is we need to do this together. We cannot do this in silos. So that's my call to action.
The one thing I'd add, I think Rigo, it's spot on, that collaboration piece. And one thing we see this is we spend a lot of time in the community, is just the role the community plays, and also non-healthcare leaders really supporting the care of their community, whether it's faith-based, whether it's, through sports, wherever the case may be. But most importantly, it's folks who understand that community better than you may understand it. So I think it's important for us all who are entrepreneurs, who are going to these areas, going to these communities, for folks who don't live in those communities, and to really listen first. And I think when it comes to aging, it's not a monolith. And also, when you think about the term older adult, someone who's 65, like we see a lot, is probably taking care of someone who's 80, 90, maybe 100 years old. So it's really critical that we think about sort of decoupling what we think about the older aging experience to be from maybe media to what it looks like in the community you're serving. And to do that really well is to kind of sit, listen, and really support folks, because, we always think about sort of what a home may be like, where that needs to be modified, and not realize that homes look a lot different in different parts of the community, different parts of this country. And it's in our best interest to learn from those who live in that community how to actually address it. So then the collaboration piece is critical. I think also having a patient model, if you will, to see, impact is also going to be critical as folks scale certain different lines of businesses. And also as the aging population changes over the next 5 to 10 years and looks a lot different than it did, 20 or 30 years ago in this country.
I'm so grateful to all of you. This was cool. I think I walked away with a couple new perspectives, and I hope that our listeners did too.
Thank you for having us.
Thanks.
Thank you.
Thank you.